If sex hurts, I want you to know that you are not alone and you are not broken. Whether it's burning at the opening, a deep ache that takes your breath away, or it feels like hitting a wall that just won't move, this video is for you. Because the women I see in my clinic every single day have been dealing with this quietly, sometimes for years, before anyone has explained what is actually going on. In this video, I'm going to break down the real reasons why sex hurts, what's actually happening in your body, and why the advice most women have been given keeps missing the mark. By the end of this, you're going to understand your pain better than you ever have. And most importantly, you're going to understand that there is a way forward. Most women who experience pain during sex never talk about it. Not to their doctor, not to their partner, not to their friends, but because somewhere along the way they were told, directly or indirectly, that this is just part of being a woman. Just push through it, use more lube, have a glass of wine first. And when these things didn't work, they stopped asking. That is not okay, and this ends today. I'm Dr. Gabi, a doctor of physical therapy and a pelvic floor specialist. I have spent nearly a decade helping women overcome pain during sex. And I'm going to be honest with you, I'm not just speaking as a clinician. I've been there myself. Early on in my marriage, I experienced pain with sex and the anxiety that came with it. I know what it feels like to dread something that's supposed to bring you closer to your partner. And I also know what it's like to come out on the other side. That's a big part of why I do this work. Here are the real causes of pain during sex and why the standard advice keeps missing the mark. Let's get into it. Number 1, pain during sex is not normal. Not inevitable, and not in your head. Before we get into the causes, I need to say something clearly, because it is the foundation of everything else. Pain during sex is not normal. I know that sounds simple, but for so many women, that is the first time anyone has ever said it to them directly. Up to 75% of women experience pain with sex at some point in their lives, and the vast majority never get treated. Not because treatment doesn't exist, but because nobody has told them to go looking for it. I had a patient tell me when she brought up pain during sex to her doctor, she was told to have a glass of wine to help her relax. That was the clinical advice she had received for pain that had been going on for 2 years. In my practice, I hear versions of that story constantly. Just push through it. It'll get better with time. That's just what happens after having a baby. And the women who hear those things do what they've been told. They push through. They wait. They stop mentioning it. And the pain stays. Here's what I want you to know. If sex hurts, whether it's a burning ache right at the opening, a deep aching pressure deep inside, or a feeling like your body just won't let anything inside, that is information. That is your body sending you a signal, and signals have causes, and causes have solutions. Pain during sex is not in your head. It is a clinical presentation, and it deserves clinical attention. But here's what surprises most women when they finally come in and get assessed. The cause is almost never what they expected. Number 2, the most common cause, your pelvic floor is likely too tight, not too weak. This is the part that reframes everything. When most women think about their pelvic floor or pelvic floor problems, they think about weaknesses, something being too loose, not holding. But when it comes to pain during sex, the most common thing I find in my clinic is the exact opposite. Pelvic floor is way too tight, too guarded, holding on when it needs to let go. Pelvic floor is a group of muscles at the base of your pelvis. And just like any other muscle inside your body, it can carry tension. It can brace, it can get stuck in a state of chronic tightness without you even knowing what is happening. And when those muscles are tight and penetration is attempted, those muscles push back, they resist, and that resistance is the pain. Think about your shoulders right now. If you've had a stressful day, they've probably crept up towards your ears without you even realizing it. And if someone asked you to just relax them, you'd have to consciously think about it, right? You'd have to take a breath and actively let them drop. You can't just tell them to relax. You have to train the release. The pelvic floor is exactly the same way. When it's been holding tension from stress, from past pain, from years of compensating, it needs to be taught how to let go. That is why kegels, for most women dealing with pain during sex, can make things worse. Kegels are a strengthening exercise, and if your pelvic floor is already too tight and you're adding more squeezing on top of that, you are moving in the wrong direction. The goal here is not more tension, it is less. And if you have been doing Kegels to try to fix pain during sex, I want you to hear this clearly. Stop, For most women with this picture, what we're working towards is the opposite. We want the pelvic floor to relax, lengthen, and release, not contract harder. But tight pelvic floor muscles don't just appear out of nowhere. Now, for a lot of women, there's something else that's driving that tension that nobody has ever connected for them. Number 3, why just relax doesn't work. Here is something I wish every woman knew. Your pelvic floor is not just a set of muscles, though they are muscles, but they are deeply connected to your nervous system and your brain, specifically to the part of the body that scans for danger and responds to protect you. And when sex has been painful, your brain starts to anticipate that pain before it even happens. It learns. And by the way it protects you is by tensing up the pelvic floor before sex even starts. That is why the advice to just relax doesn't work, because your brain is not asking for your permission. It is running an automatic protective program, and you cannot think your way out of an automatic muscle response. I want to be honest with you because I think that this part matters. I experienced pain with sex early in my marriage. And what I didn't understand at the time was that even on nights when I genuinely wanted to be intimate, my body was already guarding. The anxiety would build before anything even happened, and my pelvic floor would respond to that anxiety by tensing up. I wasn't doing it on purpose. My nervous system was doing it for me. It truly took working with both a pelvic floor therapist and a sex therapist for me to understand what was actually happening and start to unwind it. And I'm sharing that because I don't want you to spend years thinking it's a you problem. It's a physiology problem, and physiology can change. Think of it like this. If you've ever touched a hot stove, even just once, your hand will pull back the next time you reach anywhere near that heat. Before you even consciously decide to move, your body learned this equals pain, protect yourself. Your pelvic floor does the exact same thing. It doesn't wait to see if this time will be different, it just fires automatically. And here's a piece of this that always surprises women. There is a direct connection in your body between your jaw and your pelvic floor through the connective tissue that runs the full length of your body. So when you're bracing for pain, clenching your jaw, holding your breath, tensing your face, your pelvic floor is doing the exact same thing at the same time, which means releasing one, so your face, your jaw, your neck, all the things, helps release the other, your pelvic floor. Pain during sex is often a full body response, not just a local problem, and treating it means addressing the nervous system piece, not just the muscles themselves. Now, not all pain during sex is driven by tight muscles and nervous system responses alone. For some women, especially postpartum women and women going through hormonal changes, there's a tissue piece that's just as important to understand. By the way, if you're watching this and for the first time things are actually starting to make sense, you are in the right place. I put out pelvic health content every single week here on this channel, so make sure to hit subscribe so you don't miss the next one. Number 4, hormones, healing, and the postpartum body. Not all pain during sex comes down to tight muscles and the nervous system. For some women, especially postpartum women and women going through hormonal changes such as perimenopause or postmenopause, the tissue itself here at the vulva and the vagina is part of the picture. Here's something that doesn't get talked about nearly enough. If you are postpartum and breastfeeding, your estrogen levels can drop down similarly to those of a woman in menopause. Not similar to just early pregnancy, similar to menopause. And low estrogen affects the vaginal tissues directly. They get more sensitive, which means even gentle contact can cause real pain. And that is not just a pelvic floor muscle problem in the traditional sense, it is a tissue problem, and that needs a different approach. For example, I had a patient come in 3 months postpartum. She had been told at her 6 weeks checkup that everything was great and she was cleared for sex. She tried and it was excruciating. She thought that something had gone wrong during her delivery. Nobody had told her that breastfeeding drops estrogen in her body. Nobody mentioned that this was even possible. She had been suffering through it for months, thinking her body was broken. It wasn't broken, it just was going through a hormonal shift that had a name, a cause, and a solution. Think of healthy tissues like a well-hydrated sponge, flexible, resilient, able to move and stretch. tissues that are low on estrogen are more like that same sponge after it's been sitting out and drying for days. It's stiff, fragile, and anything pressing up against it causes discomfort. The solution isn't just to push harder, it's to restore what has been lost. So if you're postpartum, breastfeeding, or going through perimenopause and experiencing pain with sex, or even postmenopause and experiencing pain with sex, this is worth a direct conversation with your OBGYN or midwife, specifically around vaginal moisturizers or topical estrogen, which can make a significant difference for this picture. A pelvic floor PT and a provider working together is the most complete approach here. So whether it is muscle tension, nervous system guarding, tissue changes down at the vulva, or a combination of all three, here's the most important thing I want you to take away from this video, and that is this. Number 5, your body is not broken. Let me share with you this thing I wish someone had said to me sooner. Your body is not broken. It is not failing you. It is not being dramatic. It has been responding to pain, to tension, to hormonal changes, to years of being told that this is just how it is, and responses can be changed with the right approach. A proper pelvic floor assessment for pain during sex looks at all of it. Is the pelvic floor, is the actual muscles, are they too tight? Is there a nervous system pattern of guarding that needs to be unwound? Is there a tissue or hormonal piece affecting the vulva? And how are the contributing factors, like how you breathe, how your body moves, your posture? A proper plan is built around an assessment that is built around what's driving your pain, not just a generic program, but a plan built for your body. Pain with sex is not something you have to suffer through. It is a clinical presentation, and clinical presentations have causes, and causes have solutions. So tonight, I want you to do one thing. Just notice. The next time you feel any tension, bracing, or holding anywhere in your body, whether during intimacy or just during a stressful moment in your day, notice where it lives. Is it in your jaw? Is it in your shoulders? Is it in your belly? Is your breath shallow? Are you holding it all together? Just notice. That body awareness, the ability to feel what is happening before you start to change it, is the very first step. You cannot release what you cannot feel and notice. The women who get the best outcomes are the ones who stop normalizing their pain, stop pushing through it, and start getting curious about what their body is actually trying to tell them. Pain is information, and information is the beginning of change. So here's the truth. Pain during sex is common, but common is not normal. You do not just have to live with this. You do not have to just keep pushing through it, and you do not have to keep quiet about it. Your body is not broken. It just needs the right support. If this video helped something click for you, share it with a woman in your life who needs to hear it, and go explore the rest of the channel. There's a lot more from where this came from. I'll see you in the next one.